AMCA practice exams exam questions. Hematology includes the study of etiology, diagnosis, and treatment of blood diseases. Why is a preservative added to specimen containers that are to be sent to a pathologist? Delay decomposition. What is the general term for a surgical suture? Ligature. Which temperature site would give the highest normal values? Rectal. What is the process used for supplies that would come in contact with internal body tissue or an open wound, that involves the use of heat, steam, and an autoclave? Sterilization. If the provider of medical services wishes to discontinue care to a non-compliant patient, which U.S. postal classification should be used to notify the patient? Certified, with return receipt. Which of the following is probably the best practical method of filing warranties, tax information, medical reports, office insurance premium payments, and medical pamphlets? Subject filing. Which blood type is the universal recipient? AB positive. Even though the day's office schedule has no buffer times available, which patient would you have to fit into the day's schedule? A 50-year-old woman who requires a preoperative history and physical examination for a scheduled surgical procedure. Blood would be used for what kind of testing if it was collected in a vacuum tube containing EDTA? Hematology tests. What type of medication constricts blood vessels? Vasoconstrictors. Which of the following is a fever that comes and goes or fluctuates and returns into the average range? Intermittent. In order to achieve minimal disruption in the daily schedule while accommodating acutely ill patients, what should the medical assistant do? Leave buffer times in the appointment schedule. Which type of urine specimen, collected in a sterile container, is best for bacterial culture testing? Clean catch midstream. What should a medical assistant do before removing a patient's sutures? Advise the patient that she should feel a pulling sensation but not pain. A new patient arrives for his or her appointment and provides date of birth, home address and phone number, place of employment, and health insurance carrier. This information is referred to as demographic. When administering a drug you are not familiar with, what information should a medical assistant look up on? The route of administration, plus drug classification and dosage. Usually, freshly voided normal urine from well patients is acidic, with a pH of 6.0, 4.5 to 7.0. Which item could be a multi-dose dispenser? Vial. How is a consultation different from a referral? A consultation is needed when the physician asks for the opinion of another provider. What has HIPAA enabled patients to do? Have more control over their medical records. Which of the following on an ECG reflects the ventricular heart depolarization? QRS wave. What is the process that involves a soaking or wiping process and inhibits the activity of disease-causing organisms? Disinfecting. Which of the following is considered inappropriate communication with a patient? Touching and holding the hands of a patient intimately. Which of the following on an ECG reflects the depolarization of the atria of the heart? P-wave. What is the best way to address an elderly patient? Mr. or Mrs. underscore 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 underscore. Medication administered under the tongue follows which route? Sublingual route. Which of the following best describes the type of analysis used when processing blood for transfusions? Immunohematological. Which of the following describes the patient's chief complaint? The main reason the patient is seeking care that day. Which is not considered a vital sign? Weight. Which is considered subjective information within the medical record? Family history. After a 1-year absence, a patient returns to your office for a physical examination. The medical assistant should re-verify the patient's home address, place of employment, home telephone number. What is the average normal heart rate? 72 beats per minute. What is the scrubbing of instruments with special brushes and detergents to remove blood, mucus, and other contaminants? Sanitization. The immune system protects the body from disease and infection. Antibiotics will not cure the common cold because it is caused by virus. Medical assistants frequently work with referral laboratory customer service personnel in order to answer questions and provide special handling for specimens from their patients. Which of the following ensures test result accuracy by monitoring the test procedures performed in the medical office? Quality control program. Patient safety is protected by ensuring which of the following? You are administering the right drug to the right person. A routine hand wash procedure uses plain soap to remove transient bacteria. Hand antisepsis requires the use of antimicrobial soap. Respiration rates can vary if abnormalities are present. Which type of abnormality is a temporary complete absence of breathing? Apnea. What is the term describing the process of sharing data by linking two or more computers? Networking. If the color of a urine specimen is noted to be dark yellow, the possible cause may be dehydration. Which of the following best defines a demographic? The statistical data of a population, such as age, gender, etc. What type of consent is given by a patient after all potential treatment risks have been discussed? Informed consent. What are the 3 common types of medical records? Active, inactive, closed. The office appointment book does not need to provide space for recording which piece of patient information. Patient's address. What is the average quantity of urine produced by an adult over a 24-hour period? 1,250 ml. When calling a facility to schedule a patient, what is the most important factor to remember? To maintain patient confidentiality. A patient in the military has been stationed overseas for 3 years. The patient is now stateside and has called to schedule an appointment. Where in your files would you most likely find the record? Inactive files. Which of the following thermometers is considered the most accurate indicator of body temperature? Rectal. In order to complete the matrix before scheduling any appointments, which of the following do you not need to know? When the patients prefer to set up appointments. Which one of the following is one of the 6 C's of charting? Client's words, plus clarity, completeness, conciseness, chronological order, and confidentiality. What is the best way to prepare a patient for surgery? Send the patient home with written instructions on what to do. When does double booking occur? Booking 2 patients for 1 physician at the same time. What is the normal value range for a hematocrit reading for females? 37% to 47%. Which of the following instruments is used to drain an abscess? Scalpel. What is the proper sequence for CPR? Circulation, airway, breathing. Which of the following items should be added to the label on a specimen container? Date, plus type of specimen, examination, physical name, lab contract number, age, sex. What type of insurance coverage is provided for employees who are injured while working? Workers' compensation. Which of the following scheduling methods books several patients around the same time? Cluster booking. Which of the following would be appropriate for free screenings? Blood pressure. What is the best reason for the clinical medical assistant to check examination room supplies throughout the day? Minimizing any interruption in patient flow. Upon receiving cash in the doctor's office, what is the best way you should get it to the bank? Take it to the bank in person. What is hemophilia? Blood clotting disease. What is latex sensitivity a type of? Allergic reaction. Within a patient's medical record, in which way should the various report and examination records be filed? Chronological, with the latest data on top of the information within. What is the most important reason for documenting all appointment no-shows in each patient's medical record? To provide risk management. It is acceptable for a blood clot to form in which color top tube? Red. Which kind of blood study includes examining the blood for its total number of formed elements and cell morphology? Hematology. What is the approximate normal range for the specific gravity of urine? 1.005 to 1.030. What type of fever is known as a fluctuating fever that remains elevated and does not return to baseline? Remittent. When scheduling an appointment for a new patient, which of the following is the most important information to consider? Chief compliant, triage. Which stage of infection is known as the time where the pathogen had had time to grow and establish itself in the body? Incubation. Which procedure that requires patient intervention should be documented for patient reference? Clinical procedure. Which of the following statements is true about working in a sterile field? All sterile items should be held above waist level. How is a patient's general medical history preferably obtained? Before admission to the hospital. You decide to refuse a task. What should you do? Communicate your concerns to the nurse. A scheduled patient calls the office to change the date and time of the appointment. What do you need to do? Delete the patient's name from the original appointment and place it in the new date and time slot. Which route is involved in administering a drug by placing it under the patient's tongue and leaving it there until it is dissolved? Sublingual route. What is accounts receivable? A record of all monies due to the practice. After how many minutes after a patient has missed a patient, should the medical assistant call to reschedule? 15. A pap test specimen would be sent to which department for analysis? Cytology. You are taking vitals on a patient and they complain that they have dizziness every once in a while. What type of symptom is this? Subjective. The medical assistant should do which of the following when a patient does not show up for an appointment? Document the failed appointment in the patient's chart. When a hard copy of a computer file is needed, you must print the information. You must personally escort which type of patient to the examination room? Established, inexperienced, regular patients. What do you call the family members covered by an insurance plan? Dependents. The selection of one of the 3 available blood pressure cuff sizes depends on weight of the patient/size of the arm. What information is required on a laboratory requisition form? Birth date and gender of patient, plus date and time of collection, doctor name, test performed, source of specimen. A procedure for filing insurance claims would be found under which policy section of the procedure manual? Administrative. Of the following list, which urine specimen would contain the highest solute concentration? First morning. An RN asks you to start on 4, which is true? Assistive personnel do not start IVs, not under MA scope of practice. Which of the following sites is most commonly used in venipuncture to withdraw blood? Median cubital vein. Which type of fungus causes thrush? Candida albicans. EDTA, ethylenediamine tetrashic acid, is present in which color-topped vacuum tube? Lavender. Medical office patient records are most likely filed using alphabetic. How should you schedule appointments for the patient who habitually arrives up to an hour late for scheduled appointment times? At the end of the day. Which of the following filing systems provides the greatest amount of confidentiality? Numeric. Blood would be used for what kind of testing if it was collected in a vacuum tube containing no additive? Blood chemistries.